my name's Carl. I live in Queensland in Australia, and in a few days' time I'm booked in to have a bilateral hip replacement. That is, having both hips replaced in the same procedure. And as my surgeon said, it's not the sort of thing that you do because you've got nothing better to do on the day. Anyway, I'm lined up for it. I'm looking forward to it. So what I thought I'd do now is just to do a bit of a before and after video. For my own purposes, but also perhaps it might help other people like yourself if you're thinking of doing a similar procedure down the track. I keep myself pretty fit. I do probably 45-minute workout, which is mostly walking and up good inclines, a little bit of upper body work, and also surfing on my stand-up paddleboard when I get that opportunity. So I'm usually doing something fairly physical activity, exercise most days. I'm 70 years of age. I keep myself in pretty good shape, which I'm told is the key to going through this procedure and coming out of it the other end with the best chance possible of regaining your mobility and strength as quickly as possible. I'll briefly go through some of the things and some of the movements that I've been having problems with, and possibly you might be having problems with too. And one of the hardest things personally that I find myself having to do on a daily basis is putting on shoes and socks. So all these issues that you're having, you're not aware of them because the body's automatically compensating. You know, you'll find a different way of getting in and out of a car. You'll find a more comfortable way of putting on your shoes and socks. And so it's not until somebody says to you, well, have you hurt your leg? You know, you've got a limp. And you say, no, I haven't got a limp. You say, well, mate, you have. You know, you've got a limp. And someone will say, how come you don't stand up straight? And why are you walking funny? And all these things. And then you realise that over the years, the reason that these things are happening is because you're compensating, and the body's compensating for the osteoarthritis. It's keeping you going, it's keeping you able to do the things that you've been used to doing, but in some pretty strange ways, which can often lead to comments from close friends that say, mate, there's something going on here you might want to address. I remember on one of my consultations with the specialist, with the surgeon, he asked me, after examining me, he asked me, well, why have you left this so long? You're obviously in bad shape, hip-wise. Why have you left it so long? And I really didn't have a clear answer for him. Osteoarthritis, and in the hips in particular, is an insidious process. It kind of creeps up on you over the years. It's not something that, oh, you have a fall, you got an injury, and you know when it happened and where it happened. The osteoarthritis creeps up on you, and the body compensates over the years. One of the main issues for me in a lot of things, especially with my surfing, is not being able to open my legs. So I thought what I'd do, I'd mark just how far my legs would open now, and then see how what the improvement is like after the operation. That's pretty much where I am at the moment. And even sitting here like that, to me, is quite uncomfortable. At the moment, that's pretty much as much as I can bring my knees to my chest. If I try and pull in, not only does the pain increase, but I can feel the muscles in my stomach tensing up and wanting to cramp. Now, I'm a keen stand-up paddleboarder, and as you know, or those of you that have tried it, to maintain balance, and when the waters get choppy, you need to just open your legs. My hips are not allowing my legs to open any more than they are now, and if I try and go wider, all that happens is that my legs from my knees down splay out, which, as you can probably appreciate, is not a good look and is also bloody uncomfortable. So that's pretty much where I am now physically. So if I can free up, if the operation will free up the hips and in turn start freeing up the low back, I will consider it time, pain, effort and money well spent. But we'll see where the operation will take me.
Well, here we go.
I want you to do as much as possible.
Yeah.
How do you feel?
Yep.
Woozy?
No?
Just stay sitting. We're not going anywhere just yet.
Okay.
Do up your gown, keep you modest.
Good.
All sounds clear. Alright. Now, I know you're dangling a bit, but just shuffle.
Yeah.
So you got your feet, and when you're ready, have a stand. Pop your forearms up. Pushing through your legs. Good. Got enough length on those wound drains. How are you feeling? Got your balance?
I think so. Yeah.
Bit of a burp, not going to vomit?
No.
No. Pop your arms up just for balance.
Okay.
Yeah.
Because there was a leg length issue which now seems to have been fixed.
Nice. So does it feel a bit different?
Yeah.
Yeah.
Good.
As a little test before we go anywhere, can you just take a few steps forward and a few steps back?
I will.
Good. Pausing and just go back for me. Just sometimes the movement, I've had patients go, yep, I'm great. Take two steps and then they pass out.
Yeah.
So we just take it
I'll
slow.
do my best not to do that.
Good. How do you feel?
Yeah.
Awesome. How's your pain?
The pain is just light to moderate.
Sure. All right, you ready to try out the door?
Yeah.
Good. Off you go. I'm going to come in behind you. And we'll turn right, Carl.
Do you want me to indicate?
No, you're all good.
Oh, good.
How's your head?
Yeah.
I'm going to keep asking you, okay?
Yeah, it's fine. It's a little bit light.
Okay.
Nothing.
Heading back in.
Awesome, Dad. Well done.
The surgery had left me with surprisingly little pain, and the bruising, although significant, was nowhere near as bad as it looked, and diminished quickly. After 5 days in the hospital, I was pretty much ready to come home, but I got a visit from the head of rehab,
who strongly suggested that I spend the next week with him in the rehab section of the hospital, and it really was the most useful 6 days that I've ever spent. Surprisingly hard work, but I could feel the results every day. I don't think I've ever worked as hard in a gym in all my life. Look at me, Dad. Okay. Here we go. For better or for worse. So I've gone over the early video I took before the operation, and just to round things off and even things out. Prior to the op, that was where I was at. That was the maximum extension of leg opening that I could manage. Now, however, that's all changed, and I have much more extension now. No pain in the hips. I can sit here quite happily without any pain at all. The legs will go wider if I force them, probably a bit more than 90 degrees, I'd say. And the good news is that I could now sit on a surfboard without any issue. Putting on shoes and socks was a major challenge. It's still not as easy as I'd like, but the hips have made an amazing difference. I still have to use the chair to get my sock on, and if I choose to, I can even do it now from a standing position. So I had not a hope in hell of doing that before. One of the most common comments I got after the operation was that, hey, you seem to have grown 2 or 3 inches. Because I was finally standing upright, which is great. To be able to stand upright without any pain is wonderful. And my walking also is much more like what it should be. There's no pain. It feels good to be able to stand upright. Now when I go for a wider stance, I'm actually able to open the hips instead of having the wider stance coming from the knees and splaying out. So that was about where I was at prior to the op. Now a wider stance is absolutely no problem at all, and everything is nicely in line, both the top of the leg and the bottom of the leg, instead of having this effect. Nice and stable, pretty much as wide as I need to go and wider. I think that was about as much as I could manage prior to the op. Now I can pretty much get my arms right around without any fear of cramping and without any pain. I can actually get my pelvis on the mat and even start getting some movement back into my low back. It's been quite a journey. It's just been a little bit over a year. It's not a procedure to be taken lightly. It is hard work. Get as strong as you can going into the op, because it'll only help on the other side. You're going to be given a lot of exercises, both pre-op and post-op. I would suggest doing them as religiously as you possibly can, because that will make all the difference to your recovery. I am only getting better and stronger and more flexible as the months roll on. I'm not there yet. It's been over a year, so don't expect anything to happen overnight. It won't. So it's something I should have done, or at least been looking at 10 years before I actually did. So if you're thinking of doing the op, good luck. It can only benefit your life and improve it in every way. I wish I'd done it earlier. I hope you make the decision to do it when it's right for you. And thanks for looking.